Good morning. Today we are going to continue our lecture on drug calculations. Previously, we have looked at the various rules that we can use when it comes to drug calculation, especially for pediatrics, that is for children. And our focus today will be on injection. How do we calculate the dose of a drug whenever we are told to, maybe in exams or even whenever we are administering a particular drug to our patient. So this lecture today or class today is going to focus on that aspect with special focus on injections. Now, of course, injections are one of the very important form of treatment in the hospital, especially when there is urgent need for the patient to recover. And that is why it's very essential we also know how to calculate drug dose in that aspect as well. But previously, let's review what we did in the last class. In the last class, we started off by looking at the various rules that we have. We have about 6 to 7 rules, and all of these rules are tailored towards trying to calculate the dosage of a drug or the dose of a drug. Those ones that are specifically applicable to children. Those ones that are applicable to children. So we started off by looking at the Young's rule. We started off by looking at the Young's rule, where we said the Young's rule is one of the age-based rules. Now, what we mean by age-based rule is that this particular rule is with regards to the age of the child. That's what I mean by age-based rule. So this is one of the age-based rules. So Young's rule is one of the rules. And remember we said in the last class that this rule is applicable to children from 1 year up to 12 years. Up to 12 years. So from 1 year up to 12 years. So any child that falls within this age bracket, then you can apply the Young's rule to that child. But the moment the child is out of this bracket, whether more than 12 years or less than 1 year, then you can't apply the Young's rule. Secondly, we also looked at the Dillon's rule. Looked at the Dillon's rule, where we said this rule is similar to the Young's rule. Now there are similarities in terms of the coverage. That is to say, the Young's rule is applicable to children's age in year or years, as the case may be, while Dillon's rule is also applicable to children in years as well. But I think the major differences between the Young's rule and the Dillon's rule is just the denominator. If you go back to the last class, you can see the formula there. Then the third rule, which is still one of the age-based rules, is the Friedman's rule. The Friedman's rule. Now the Friedman's rule is also focusing on age, but this time around not in years but in months. So if you want to calculate the dose of a drug for a child that is still within the age bracket of months, then you can use the Friedman's rule. So that is to say, for Friedman's rule, the age range is from 1 month to 11 months. From 1 month to 11 months. So if a child is less than 1 month, this rule cannot be applied. If a child is more than 11 months, of course, you cannot apply this rule as well. So this is the Friedman's rule. And of course, we have taken so many examples with regards to these age-based rules. Now, let me take it again. Why do we call it age-based rule? We call it age-based rule because if you look at the formulas for all of these rules, there is one common parameter. The common parameter there is age. The age can be in years or in months. For Young's rule, the age is in years or year, as the case may be. For Dillon's rule, it's also in years, while for Friedman's rule, the age is in month or months. So that is why they call them age-based rules. age-based formulas. Now, but the unfortunate thing with the age-based formulas is that there are a lot of scholars that are against these rules because of some of the discrepancies that we used to have, especially with children. Take for instance, you can have, let's say we have two children. Out of these two children, they are of the same age. Let's say both of them are 5 years. They are 5 years. But unfortunately, one of the child, despite the fact that two of them are of the same age, both 5 years, maybe this one is 5 years, the second one is also 5 years. But if you look at their body size, the first one is maybe the body size is is very slim, right? While the other one is looking floppy, maybe due to some other factors, and all of that. But in terms of age, they are the same. Now, if I want to apply any of these rules, let's say the Young's rule or the Delling's rule, to calculate the dose these two children will be administered with, right? Now, of course, we are rather the same dose for the same drug, but unfortunately, or we are going to have problem is the child that is 5 years, the dose might correspond to his age based on his body size and all of that. But the child that is very floppy, the way the body size is, that is how his organs, both the excretory and the metabolizing organ, that's how their own size will also increase. So that means this child that is floppy, ideally, should require more dose than the other child that is slimming or that is looking not having much body size. So if you administer the same dose to them, there is high chances or possibility that the child that is floppy might have some issues with regards to his own dose. Probably the dose might be an underdose. And that is why a lot of scholars or schools of thought are actually against these age-based rules because of these discrepancies or issues. So meaning most times they will even tell you these age-based rules are not too accurate to be relied upon. And that is why the best ones are those ones that are weight-based rules. Those rules that have connection or connections with weight. So those ones, of course, if we want to make care of this, we want to use the same example of these two children, where one is looking very fat or floppy, and the other one is very slim. Now, if we are to use their weight, what you are going to have at the end of it all is the one that is slim or very, not too fat. You're going to give him exactly what his body needs based on his own weight. Likewise, the one that is looking floppy. This time around, there won't be any form of maybe giving an underdose, based on the child's age. It's not going to be applicable here because the one that is having a floppy body, his organs are also big in that regard. So whatever you have as the dose will suit his own age based on his own weight. So that is why a lot of schools of thought are in support of the weight-based rules because of how accurate they are. They are very, very accurate. There won't be room for underdose or room for overdose and all of that. So you have an accurate dose whenever you use the weight-based rules. So as a quick one, we have already done this in our previous class just to review and also draw attention to some information that we need to get more. Now, the fourth one, which is based on weight now, is the Clark's rule. Now, this Clark's rule is also based on weight, but the weight is not in kilogram, but rather the weight is in pounds. We have already mentioned the formula previously. You can review your note and see the formula. So the weight is in pounds and not in kilograms. So if you are in a country where we are using kilogram as our unit of measuring weight, that is to say you have to convert these pounds to kilogram. Sorry, you have to convert this kilogram to pounds rather. If you are in a country where the unit of measurement is kilogram and you have a formula that in the formula the weight is represented with pounds. So if you want to use that formula to calculate the dose of a drug for that child, you have to convert that kilogram that you have weighed the child using your own measuring instrument in your facility or in your house, and you have to convert that kg to pounds. But if you have an instrument that is already calibrated in pounds, then there is no need for you to convert to kilogram. Of course, we have already established previously that 1 kg, there is a strong relationship between kilograms and pounds. That is to say, 1 kilogram is equivalent to 2.2 pounds. So if you have this conversion factor, it will be much easier for you to convert either ways, either from kilogram to pounds or from pounds to kilogram. Either way you can convert. So this is the fourth rule, and this one is one of the weight-based rules. Then the second weight-based rule is the hamburgers rule. Is the hamburgers rule. We have already done all of this. We have done this. This is just a quick review before we continue to our lecture today. Now, hamburgers rule is also one of the weight-based, but in the case of Clark's, we used in the case of Clark's rule, we used pounds, right? But this time around, pounds is replaced by kilogram. So the weight is in kilogram for hamburgers rule. Then another differences between the hamburgers rule and the Clark's rule is with the denominator. The denominator for Clark's rule, remember we said, is 150, while the denominator for the hamburgers rule is 70, indicating the average weight of a human being, that is a normal human being. So 150 pounds is the average weight of an adult in pounds, while 70 kilogram is the average weight of an adult in kilograms. So that is the major differences between that. We have several differences between the Clark's rule and the hamburgers rule. But the major one is in terms of the denominator, where 150 is for Clark's rule and 70 is for hamburgers rule. So this is the second weight-based rule. So the third weight-based rule is the one that has connection with the body surface area. That is the one that has connection with the body surface area. So it has connection with the body surface area. So you can also use this to get the dose that you can use to calculate. You can use this particular formula to also calculate the dose of a drug that you administer to a child. So this is the third age weight-based rule. Of course, we have already given the formula, so you can review the note in the last class, and of course to be able to apply it when needed or necessary. So now today we'll continue with what we have already started, and this time around, as I said earlier, we're going to focus on injections. Now this is the book I'm going to be using for the whole of this discussion, and of course I believe you all have it. That is Calculations in Pharmacology for Nurses. It was one of the book I wrote, and I believe it's a book that will serve this purpose, the purpose of knowing how to calculate drug dose for pediatrics, specifically for pediatric patients. So if you have this book, I believe you'll be able to solve any calculation related questions, whether in exam or even in real life practice. When you have a patient that you need to administer a particular drug to, you can quickly recall what is in this book, then of course you get the exact dose to administer. So this is the book I will make a reference to. We'll be looking at everything that is here in terms of the examples, and possibly also we'll look at the sample questions. That is the exercises that we have at the towards the end part of the book. So let's start with the first example. Well, let me read from what we have here. In calculating drug dosage for an injection, first, calculate the amount in milligram or any other appropriate unit which stands as required or the prescribed dose. Then, the formula below is used to calculate its equivalent in ml before withdrawal from a vial or an ampoule. Now, this statement that is on page 20, of this book, on page 20. Now, what this statement is saying is, there's a formula we're going to I'll be seeing later, that formula is applicable to calculations that involve injection only. Though we can use it for some other calculations, but for this very class, we are going to be using it to calculate the dose of a drug, the dose of a drug, but this time around, specifically for injections. Now, the statement that we just read, what it means is, if you are calculating the dose of a drug that is an injection, if that drug is an injection, if it's an injection, there are two steps or two ways to calculate the dose. There are two steps. If you have two steps or you have one step, depending on the situation. You have either two steps or one step. Now, if it is one step, what I mean by one step is you just apply the formula straight away. Let me write the formula. The formula is dose. That is the dose of the drug you want to administer. Is equal to required strength, required strength, required strength over stock strength multiplied by volume over 1. So this is the formula. So now you can apply this formula for drugs that are prescribed for it to be administered, in that's a drug that is prescribed as an injection that needs to be administered. That's when you can use this formula. So once the drug is an injection, you can apply this formula. Now, this is the first one. This formula is used, that is the first step I want to explain now. You use this formula if the dose has been given to you already. That's when you use this formula. You use this formula only when the dose has been given, meaning the drug or the dose that you administer to that child has been prescribed, has been written on the patient's folder or any other area that is being written, depending on your setting. So if it has been given to you, all you need to do is to use that dose to get the dose for the drug. Now let me clarify this. What you are using this formula to get is not something new. What this formula is meant for is, since the drug is an injection, and injections come, all of the injection comes in what? In liquid form. Let me use that word. They come in liquid form. Now, since they come in liquid form, for you to be able to administer the drug, that means you have to calculate the equivalent of that dose that has been prescribed for you. That dose that has been prescribed for you is what you are trying to get the equivalent of that dose in what? In mil. Since injections are liquid, so whatever you are going to get must be in what? In mil. Now let me take it again. If you can remember from the conversion class, we said any drug that is given in mil or anything that comes in mil, it must be a liquid. That is one of the units for volume. It must be in what? In liquid. And this particular formula is used for injection. And of course, injection comes as what? As liquid. So what this formula is telling us is, whenever I want to use this formula to calculate the dose of a drug, it simply means that the dose has been given. That is the first step. So you are trying to get the equivalent of that dose in mils. You are trying to get the equivalent of that dose in mils. Because if I ask you to withdraw certain milligram from a drug or from an injection, it will be difficult for you to withdraw. But you can confidently get the equivalent of that dose in mils, then you withdraw using your syringe. Take for instance, if we are using, let's say, paracetamol injection, right, that comes as 300 milligram in a 2 ml bottle, or the volume is 2 ml, and a child has been prescribed to take paracetamol, let's say 80 milligram. Now this is the prescription, 80 milligram. So if a child is taking 80 milligram and I hand over, this is our paracetamol injection. Now this is paracetamol injection. Now if I give you this injection to administer 80 milligram, it will be very, very difficult for you to bring out 80 milligram. It's not possible. The only possibility is This 80 milligram, you can get the equivalent of this 80 milligram using this formula. So whatever you get in mils will be the equivalent of this 80 milligram. So in other words, this formula is used to convert a drug that is present in either milligram, right, or gram, or any other unit to get the equivalent of that same unit in what? In mils. So if it's 80, if I give you this ample now, you can't bring out 80 milligram, except you get the equivalent of that 80 milligram in mil before you now administer. So I believe I've explained it in a better way that I believe you are going to understand. So this is the first step. This is the first step. And I said we have two steps if you want to use this formula. The first step is a step where that involves just one step, just this formula. You use just this formula. And this one is applicable only when the dose has been given to you. But in a situation whereby you are the prescriber, if you are the one prescribing the dose, right? Maybe the patient met you, and after your history taking, you're able to get some information. So you want to now commence the treatment. So there are two different things. The first one is the dose has been written for you. Yours is just to administer. But the second one here is the dose was not given to you. It's you as the healthcare provider, or as the nurse, or as the doctor, or whatsoever. You are the one that will get the dose yourself. So that is the one that involves two steps. Now let's see how that one works. Now, this second one that involves two steps is where the dose will be provided by the prescriber. For instance, let's assume I have a patient that is running temperature and I need to give paracetamol. Now, of course, I will sit the patient down, maybe either the mother or the patient, depending on the age and how the child can communicate. I'll take the history, and once I'm done with the history, I want to know the weight, for instance, if I want to use weight, or I might want to know the age of the child if I want to use age for the calculation of the dose. So now, if you are the one getting the dose yourself, that is when you are going to apply any of the 6 rules or formulas that we have mentioned in the last class. Get the difference. If you are the one initiating or commencing or starting the treatment, that implies to say you are going to get the dose yourself. So if you are getting the dose yourself, then to get the equivalent of that dose in mils, it must involve what? 2 steps. The first step is to use any of those rules that we have mentioned previously to get your dose. Then after which, you will now use that dose, which is in milligram, for instance. You will now use that dose that you have calculated in milligram to get the equivalent of that dose in mils. Get it in mils altogether. So that is why I said it involves 2 steps, and also there are those ones that involves 1 step. If it's 1 step, you use this formula directly without going through those 6 rules. Then if you are using those 6 rules, any of them, based on your information. If you are using weight, maybe you have weighed the child. Okay, from the weight you can use the hamburger's rule, or you can use the Clark's rule. So if the weight is in kilogram, I want to use Clark rule, you convert that kilogram to pounds and use the formula. If the weight is already in kg and you are comfortable with the hamburger's rule, then you can now use that same kg, input it in the formula, then you get your dose. Now, once you get the dose, you can now convert that dose using this formula. The equivalent of that dose in milligram can now be calculated using this formula to change it to what? Mil. Then you can now withdraw from your ampoule from using your syringe. So let's take some of the information here. Now, the first information here is we have already defined what a dose is. And we said a dose simply means the amount of a drug that is to be administered. That is the amount of the drug you want to administer. So I can administer 10 milligram. So 10 milligram becomes my dose. 5 milligram, 20 milligram, 40 milligram, all of these are they are all doses. Now, so that is the amount of drug you are going to administer is the dose. Now, the required strength. Required strength means the amount that has been prescribed for the child to take. If the child is to take 10 milligram, that is the amount, or that is the required strength, the amount, the strength required for the child to be administered with, or for the child to take. That is what has been prescribed, or what you have calculated in the case where you are the initiator of that treatment. But if you are not the initiator, somebody is prescribing for you, maybe in the case of the hospital or any other place, then you now use that dose that have been prescribed for you as what? As the required strength to be given or administered to the patient or the child. Then the stock strength means what you have in your facility. Now, that way you can say what you have in your possession. And this one, you don't need to find it anywhere. You always have it. Take, for instance, this is paracetamol injection, right? Now, if I look through this paracetamol injection, one ampoule of paracetamol injection comes like this. If you look at the label on the ampoule, this is what you will see. You will see 300 milligram per 2 ml. So what does this mean? This means the weight of the drug is 300 milligram and the volume of the drug is what? 2 ml. 2 mils. So this is 300 per 2 mils. So this automatically becomes my stock strength. Now, why we call it, why I said it's something that you have in your possession. Right now, let's assume I want to administer this paracetamol injection. I have it in my possession right now. So all I need to do, even if I have never administered this drug, since I have it in my possession, all I need to do is just go through the label here. What you see is you see the stock strength written boldly. It's always written. There's no ampoule that you don't find the stock strength and also the volume. They are always together. So this is paracetamol injection 300 milligram. So this is the 300 milligram. So automatically my stock strength for this drug is now 300 milligram. Now the volume. The volume here, you also see the volume. You can see from here, and that's what you're going to see written. The volume here is 2 mils. So that means I'm going to use 2 mils here. Then this one is, of course, it's not relevant. You don't need it in the calculation. So this is the interpretation of this formula. So now, all of this you have it. If you are administering as a nurse or as a healthcare provider, the required strength is in the prescription sheet. The stock strength is in your possession. You have it right there. The volume also is also with you, attached on the ampoule. Now, what if the drug is a vial? What if the drug is a vial? For instance, ceftriaxone. Now, this is ceftriaxone. This is ceftriaxone injection, and it comes as a vial. You can see the powder substance. The powder substance. Look at it. It comes as a vial. In a vial. It comes in a vial as a powder. So that means you will have to reconstitute this vial. You have to reconstitute. What I mean by reconstitution is it comes with 2 diluents. This particular brand. This brand comes with 2 diluents. The first diluent is water for injection or sterile water, which is 10 mils. Then, in addition to sterile water, we also have lidocaine that comes as 5 mils. Comes as 5 mils. So this is 10 mils water for injection and 5 mils lidocaine. Of course, these two are not to be administered the same time. It depends on the route that you want to use. Now, if this is ceftriaxone that comes in a vial, that I need to reconstitute, the stock strength will automatically be the weight of the drug, which is 1 gram. 1 gram. But remember, we said there is a relationship between gram and milligram, right? Where we said 1 gram of a drug is the same thing as 1000 milligrams. So I can also say that this same 1 gram is the same thing as 1000 milligrams. So my stock strength is now 1000 milligram or 1 gram. Then the volume depends. The volume depends on the liquid I'm using. If I'm using water for injection, my volume will be 1 gram or 1000 milligram in 10 mils. If I'm using water for injection to dilute or to reconstitute. But if I'm using lidocaine, then it will be, the volume will be 5 mils. So depending on what you want to use or the route you want to use. If you want to give the drug intramuscularly, if you are giving the drug intramuscularly, then you dilute with what? With the lidocaine. That is the 5 ml lidocaine. If you want to give it intramuscularly, because this drug is painful when you give it without xylocaine and you give it intramuscularly. It's very, very painful, very, very painful. So that's why the xylocaine, which is a local anesthetic agent, is to help to curb or manage or prevent the pain while you are administering it intramuscularly. Then, if I'm administering it intravenously, then I'm going to dilute with the sterile water or water for injection, which is 10 ml. So my volume in this case becomes what? 10 ml. So that is how to get the volume. In case of a vial, when the drug comes in vial, you can get that using the diluent. The volume will now be gotten from the diluent or the liquid or the liquid you use to dilute it. The amount becomes your volume in the case of vial. I believe we have tried to explain it in a way that you understand it better. So that is that constant. So let's quickly take examples. Let's take examples. Now, the first example I'm going to take will be examples that have. Okay, let's start with the example here. Let's start with the example, and that is on page 22 now. On page 22 of this book, Calculations in Pharmacology for Nurses. So let's start with example 1 on page 22. On page 22. So example 1 on page 22. Now let me read it. Now, a 6-year-old baby was rushed to a facility with history of febrile convulsion that has been on and off for 24 hours. The child is to be administered paracetamol and diazepam injections. Calculate the amount of these drugs you will administer to the baby in ml. If the adult dose of paracetamol is 600 mg and diazepam is 10 mg, take 1 ampoule of paracetamol to be 300 mg per 2 ml and diazepam 10 mg per 2 ml. Now this is an example that we need to solve, but let me quickly interpret this example. Now what we have here is a situation where you are the person initiating the treatment. For instance, I'm the one initiating the treatment. So in this case, I'm going to calculate the dose of the drug. I'm going to calculate the dose. But if I'm not the one initiating, somebody is prescribing for me, then of course I will use this formula. But since I'm the one initiating the treatment, I'm the one that took down the history, then in this case, I will have to calculate the dose that I'm going to use for the child. Now, if you look at it, we said the dose of the drug can be determined in 2 steps. First, use the Young's rule to determine the amount the child will take in milligram. Now, it must not be Young's rule. You can use any other rule, especially Dillon's rule, because both of them they are the age-based rules that comes in years, and the child's age is 6 years. But let's stick to what we have here. So since the child's age is 6 years, so the moment I see 6 years, I know that okay, the formula that will be applicable, that will be appropriate for this child's dose is the Young's rule or the Dillon's rule. But let's use the Young's rule. Let's use the Young's rule. Now, the another very important thing again is what? The adult dose has also been given. So I'm having the age of the child in years. I'm also having the adult dose in 600 milligrams. Then for me to now calculate the dose I'm going to administer, I have to use this formula. That is the Young's rule. Now, what does the Young's rule say? The Young's rule says, that is the formula for the Young's rule, says the dose of a drug is equal to age of child in years or year, as the case may be, multiplied by the adult dose over age of child in years plus 12. This is years. Let me write it. This is years. Years or year, as the case may. So this is the Young's rule. This is the Young's rule. The dose of the drug they are going to administer is age of child in years or year. If the child is 1 year, then that will be S, just one year. But if it's years, that's more than this one. The case of this one is years because the child's age is 6 years. So age of child in years multiplied by the adult dose over age of child in years plus 12. So this is the formula that we are going to use to calculate the dose of the drug. So we are using the Young's rule. Now, the parameters that we need to collect from the book is already there. We have age of the child. We have age of the child, which is 6 years. We also have the adult dose, which is 600 milligram for paracetamol injection. Then we also have 12 here. So that means we have all our parameters intact. So it's now left for us to quickly calculate the dose. Remember the question says we are going to calculate the dose in mils, but we need to get the dose in milligram before we now get the equivalent of that dose in milligram in what? In mils. So now let's apply this formula. Of course, we already have the formula. Let me claim because of space. Now, since we have the formula, and to calculate the dose now, it will now be age of child in years is 6. Adult dose is 600 over age of child is also 6 plus what? Plus 12. So this will give us, it gives us 6 times 600 over 6 plus 12. So if we do it, we will arrive at an answer. So I think we arrive at 200 milligram. About 200 milligram. So let's say it's 200 milligram. So if this is 200 milligram, the dose that we're going to give, that is the dose of paracetamol injection a child of 6 years will take is 200 milligrams. So automatically this is now our dose. But let me take our mind back. If I give you this ampoule now, this paracetamol ampoule, to bring out 200 milligrams, it will be difficult. Why? Because the whole of the ampoule itself is 300 milligrams. So if it's 300 milligrams, you just withdraw the whole volume. If it's 150 and this is 2 mils, if it's 150 milligrams, I'm taking 1 mil, which will be equivalent to 150. But you have a situation here, 200. How do you bring out 200? It will be difficult. But I can get the equivalent of this 200 in what? In mils. And that's why I'm going to apply the second formula. Now, the second formula is, already we have calculated our dose in milligram. Now let's apply the second formula to get the equivalent of this 200 milligram that we have calculated. Now let's apply this. Now the dose will now be, required strength is now 200. That is 200 milligram. What is the stock strength? The stock strength has been given in the equation. But even if it's not given in the equation, since I'm going to administer it, I already have it in my possession. I can look through and just take it. But in the equation is given to you because this is an equation. But in real life, you can get it yourself by looking at the ampoule. So this is now 300, which is the stock strength. Then the volume is what? Is 2 from the equation and also from the ampoule. You will find it. The volume is 2 mils. So over 1. Now, if you look at this, here you have 400 over 300. 400 over 300. So the dose will automatically give us, from here, will give us around 1.3. So 400 divided by 300 will give us 1.3 mil. 1.3 mil. So you can see. Now this 1.3 mil is the same thing as 200 milligram that we calculated earlier on for the child. But since I cannot withdraw 200 milligrams, since the drug is in liquid or in volume, I can get the equivalent of this 200 in mils, which is what I have just done. So it will be much easier for me to break my ampoule. Once I break my ampoule with my syringe, I can withdraw 1.3 mil. So 1.3 mil is the same thing as 200 milligrams. 200 milligrams. So that's what we are trying to aim at, or what we are trying to get. What we are trying to get is, if you are using this formula for calculating injection, then what you are aiming at is to convert the equivalent of milligram into what? Into mils, so that you can withdraw it. Because if you leave it in milligram, you cannot withdraw it from this amp. So that is just the basic information that you need to get. So I believe we have done that. So let's take maybe one or two more examples for clarification, for better understanding. Then, of course, you also go through the practice questions or the exercises at the back. Now, from the book, let's go to page 11. We'll go to page question 11 rather. Let's go to page 61. Page 61 from the calculation book. If you go to page 61, that is under the practice questions. Page 61. Now, if you go to page 61, question 11. Now, I'll read it, then we'll solve it together. I'll read, then we'll solve it together. Now, it's a part of the practice questions. It says, a patient is prescribed 10 milligram. A patient is prescribed 10 milligram. So here now, we have our prescribed dose. So this is a situation where the dose has been prescribed for you. You're not the one prescribing it. You're not the one initiating the treatment. So this one, it has been done for you. Unlike the example we just gave. The example we just gave is a situation whereby you are the one taking the history. But this time around, it has been done for you already. So now, let's take the information down. The amount prescribed. So the amount prescribed is now the required strength, because that is the strength that you are going to give to the child. The required strength, I'll use this short form, that is RS is required strength, is what? Is 10 milligrams. So this is the dose you have to give to the child. Now, it says, the question reads, a patient is prescribed 10 milligrams of dexamethasone. The concentration available is 4 milligrams. They now say concentration available. Now, this concentration available is the same thing as your stock strength and the volume. This is how it comes. They say from the question is concentration available. Let me just write. Concentration available is 4 milligram per mil. So that means the stock strength of this dexamethasone is 4 milligram, and the volume of the drug is 1 mil. So that means my stock strength will be 4 milligram. My stock strength will be 4 milligram. Then my volume will be 1. So if I have this, how to calculate the dose? That means this is what we want to calculate. This is what we want to convert from milligram to mil, so that we can withdraw the drug. So this is like this, utilizing the formula that we have already stated previously. I'll write the short form, that is dose is what? Required strength over stock strength multiplied by volume over 1. This is the formula. Now let's substitute the information we have just erased. Now the required strength is 10 milligram, right? Then the stock strength is 4 milligram. Times volume is what? 1 over 1. So this will give us 10 over 4. This will give us 10 over 4. 10 over 4. So what do we have for 10 over 4? 10 over 4 will give us around 2.5, I guess, around 2.5 mil. So you can just do the calculation, around 2.5 mil. So that means, that is to say, 10 milligram of dexamethasone is the same thing as 2.5 mils. Same thing as 2.5 mils. So this is what how to calculate. So we have used the two versions now. The first version we explained, or the first step we said, was if the drug was prescribed for you. So that means you already have the dose. All you need to do is to use that dose to get the equivalent of it in meals. But the first case that is the example we use of the one that involves two steps. In this case, the dose has not been given. It's you that will find it, and once you find it, you can now apply it using based on the information. You can use any of the rules. If it's a month based age, you use Friedman's rule. If it's age that is in years, you use the Young's rule, or you use the Dillon's rule. If it's based on weight, then you can use the hamburger's rule, or you use the Clark's rule, or you can use, if the height is given, also height, weight. In that case, you have to use the one that involves body surface area. So these are ways we also have so many practice questions still on this same example. For instance, on that same page 61, we also have examples of prescribed doses in question 11, 13, and question 11, 12, 13, 14, 15. All of these questions under the practice session are questions relating to drug calculation, specifically for injections, calculating for injections. So I think we'll end this session here. We'll continue from, I think the next one will be calculations that involve tablets. That's the number of tablets you can remove whenever a particular dose is prescribed. So see you in our next class. Thank you very much.